A little bit about just kind of anatomy of muscles and a little bit of the basic naming systems. And then what we'll be doing for the last little set of muscle stuff here is on one of the other pages there, I'll have the list of muscles and I will go through on an app and actually show you some of these different muscles. So when we're looking at the skeleton, we talked about axial and appendicular divisions. We can really kind of say the same thing with the muscles. Axial muscles would have origins and insertions, which is kind of the less movable part and the more movable part of the muscle. That would be on the axial skeleton. Again, it's going to be dealing mainly with the vertebral column, the head, some of the movements like that, where your appendicular muscles control the movements of the limbs, as well as kind of the pelvic girdle. So you can kind of see some of the different muscles here. We're going to be going through some of these ones. Like I said, we have a muscle list that you're responsible for. I will kind of show you most of them on a muscle app on my iPad. I'll tape that and we'll kind of see those ones on here. And you can see even from the posterior side where some of these muscles would be at. So when we're talking about a muscle again is going to get shorter. There's going to be, generally it's going to be crossing a joint on a lot of these things here unless it has an aponeurosis, like the ab muscles and a few of the other types of muscles that we'll look at. But when you have a muscle, it's going to get shorter. Usually it's pulling against something and then using that to cause movement on the other end of the muscle. So the less movable part of a muscle is called its origin. So like on the biceps brachii, it's going to be up on the scapula, up on your shoulder, up here. The insertion is the more movable end of the muscle. So in the case of the bicep, it's going to be on the ulna and radius, and it's what's going to allow you to shorten and bring about the movement. So again, if you know origins and insertions, the muscle, all it can really do in between those is get shorter, and that's going to give you the particular action of the muscle. On the list that we're talking about, you need to know the muscle, be able to identify where it would be at, as well as know the action of said muscle. So you can see right here, origin on this one is up here at the top. Insertion is on the radius here, helping to move the radius and ulna in a flexion type of motion. And again, you can see it here kind of labeled again. Sometimes these are a little bit more difficult. Like I said, if you have a broad aponeurosis, sometimes that'll be an origin or an insertion. Sometimes you can have several tendons at one end and one at the other. And sometimes these can be all considered an origin, or a single tendon can be that insertion. It depends on some of these with the origins and insertions. Again, not going to make you know all of these, but if you do know the origins of a muscle and the insertions, you'll know what the muscle action is going to be. So the difference between the origin and insertion, the origin is the less movable part, the insertion is the more movable end of the muscle where the movement's going to take place. So the other thing I wanted to kind of talk about a little bit is getting into how muscles are arranged, and that gets into a little bit of how muscles are named. You can see muscles sometimes can have different arrangements to them in terms of how that fascicle is arranged. So you can have circular, parallel, convergent, and pennant muscles. Circular muscles, this is going to be something like around your eyes or your mouth. Circular range one here that sometimes when they're smooth muscle or sphincter, but when that muscle contracts, it's going to make it smaller. So when you're doing something like this, that would be a circular muscle, that orbicularis oris muscle, for example. Parallel muscles, these are the fibers are running on this long axis. Like I said, have a belly of the muscle, and this muscle is going to get shorter when it contracts. A good example of a parallel muscle would be the biceps brachii right here. Has a little bit of thicker belly in the center here, narrows on each end. But this muscle, all the fibers are running in exactly the same direction. That's a parallel muscle. Convergent muscles, these are going to be things more like the deltoids or the pec, where you have a wider attachment on one end and it's narrowing to a point on the other end. Could be a tendon, could be a fiber that it's attaching to. A lot of the times these muscles are more triangular in shape. Like I said, pec is a good example of this one. Again, generally can't pull as hard as a parallel muscle because they have a broader area that they're pulling from to a point. Pennate muscles, these are ones that the fascicles are actually, it's kind of like if you think like a spine of a feather and then all the little pieces of the feather going to that spine. That is what a pennant muscle is. So it has a tendon or multiple tendons going through this, and these fibers are running at oblique angles to that kind of seam in the muscle, that tendon. Like I said, it can look like a feather on these ones. If you think about a feather with the main spine of the feather and the little blades of the feather going like this. And you can have some different types of these ones. A lot of times they can generate a lot more tension. They're actually quite strong muscles, and you can have 3 types: unipennant, bipennant, or multipennant. A unipennant, you'd have the tendon on the one side like this, all the fibers going into it like this. That's a unipennant one. Bipennant would be down the center, much more like a feather, where you have the fibers coming in on each side. And a multipennant one, you have multiple spines with these going in each of these, so your deltoid is a good example of one of those. And you can kind of see the idea right here. Bipennant, you can see the seam running right here. The fibers are all going in this direction to that seam. Unipennant, you can see it right here, all moving to that one side. And then the multipennant, the deltoid, you can see coming in from each side down these little, each one of these looking a lot like a feather. As well as we can see the convergent muscle. This would be that parallel muscle, and then the circular muscle up here. And some examples of them actually on a cadaver. So which one's a little bit stronger? Well, it's those pennate muscles, because they're kind of pulling against that seam there. There you can get a lot more muscle in there. The last thing to kind of talk about a lot of these ones here is talking about the movements of a muscle. A lot of times when we talk about a muscle, we're going to have like a muscle group. You're going to have kind of the thing that's the main mover. So a lot of times we'll call this the prime mover, or the agonist, that's going to contract to produce that movement. So triceps brachii is examples given here. That is the agonist for extending the forearm. And the antagonist muscle, if we're defining the triceps brachii as the agonist, the antagonist is going to be working against that, or the opposite movement, which in the case of the upper arm here is the biceps brachii acting as the antagonist, doing that flexion. There is also a lot of times muscles that help with these movements but are not the main or prime mover, not that agonist. These would be synergists. So these are like the brachialis and the biceps brachii work together at that elbow joint to help bring about that flexion movement, as an example. So like it says here, synergists a lot of times most useful at the start of movement, helping to begin that movement. An agonist, again, main mover here. Synergist is a muscle that's helping out the agonist. So a lot of times they do intermuscular injections. A lot of times deltoid is the main thing there. Deltoid and the gluteus maximus are a lot of times where they're doing that one. Allows a large amount of muscle to be given without it going directly into the bloodstream. So the last thing I want to talk about here is a little bit about how muscles are named, giving ideas about regions and some of the other things that go into this. A lot of times with muscle naming, we will use part of the action of the muscle. So example, a flexor. So flexor digitorum, it flexes the hand. Extensor digitorum, pronator, it's going to lead to pronation. So a lot of times a muscle action is included in the name. Other times it's going to be a specific body region. So tibialis anterior, for example, it's in the front of the tibia. So it gives you an idea of superficialis, internus are these ones that could be closer to the surface, deeper into the body. So kind of gives you that idea with specific body regions. The other thing here, muscle attachments a lot of times are used in this. So the sternocleidomastoid, that is the sternum, and the mastoid and the clavicle are the parts that help with the origins and insertions on this. So muscle attachments are sometimes used in this. So that's showing you the sternocleidomastoid and its different insertions and origins. Other times it's going to be orientation of the fibers. So external obliques, it's the angle of that muscle, the rectus, lengthwise fibers. Other times it's going to be muscle shape. So deltoid is shaped like a triangle. The rhomboids are shaped like a rhombus. Orbicularis is circular. Trapezius, trapezoid shaped. Sometimes it's also going to be length of muscles. So brevis for shorter ones, longus for all ones that are obviously not shorter. are some other ways that we get some of these naming systems here. And then finally, a lot of these ones, the size of the muscle. So gluteus maximus, the biggest one there. Minimus, the smallest. Medius, middle. You can get some examples with that one. Sometimes we'll talk about minor and major as well as bigger and smaller. Other times we'll use the number of heads of that muscle. So the biceps, 2 tendons of origin. Quadriceps, 4 heads. Triceps, 3 heads of that origin on that one. So again, you can see a lot of things go into the naming on these ones, and sometimes if you learn those things, it will help you out on this. Really, other than that, muscles are using a lever system. So we have a flex point, fixed point of lever. That's our fulcrum. In most cases, it's a joint in the body. And what we're doing is using that muscle to generate a lever system to overcome that opposing force, the gravity or weight of the arm, or whatever else you might be lifting. There is different types of levers. I really don't want to get into the different types of lever systems